Hello and welcome to Corruption Chronicles. I am Debbie Peterson, your host. And tonight we have a very special guest who's going to talk with us about some issues in the United States health system. And he has a book out about it and some great suggestions for us tonight. My mission with Corruption Chronicles is to encourage, inspire, and equip people to actively participate in their local government and to tell their stories of corruption, how they found it, and then how they fixed it. But back to Alan Lawhead, MD. He's a physician leader and patient advocate committed to excellence in patient care and optimal health for all Americans with over 35 years of experience in patient care. He's been recognized as one of America's top physicians by multiple organizations, Castle Connolly, Top Doctors USA, Super Doctors, the New York Times, Atlanta Magazine, and he's been featured in the Atlanta Business Chronicle. After completing his gynecologic oncology fellowship at Memorial Sloan Kettering Cancer Center in New York City, Dr. Lawhead spent his career in Atlanta, Georgia as a gynecologic oncologist, physician leader, clinician scientist, and healthcare educator. He held faculty positions at Emory University School of Medicine, the Medical College of Georgia, and the Morehouse School of Medicine. He'll share with us how to survive a U.S. healthcare system that has become the third leading cause of death and leading cause of bankruptcy for Americans. Welcome, Dr. Lawhead, and thank you for joining us tonight.
Debbie, I'm glad to be here.
Yeah, I'm really glad you're here too, because I lived in Britain for 20 years. And I was a beneficiary, my son was born there, of their almost free universal health care. I was married to a doctor and I had a lot of friends who were doctors. So I have some insight into that system. And while it wasn't perfect, it had some big advantages over the American system. For one, my doctor friends were horrified at what we pay for medical care, because not only do we pay for it through our taxes, we pay for it through our insurance, and then we pay for it through co-pays and deductibles. And in Britain, you hear in America all the time, oh, well, they pay such high taxes, but we don't. We pay a lot more for our health care. And what's worrying to me is that not only do we pay more for our health care, but we get less for our money. There are third world countries that have some better statistics than we do, and almost all the first world countries now are beating us on their healthcare statistics. So I am particularly interested, Dr. Lawhead, in what you have to say about our medical system. I believe your book is out. Is that out yet?
It is out right now. People can order it on Amazon, so it's out. Yeah.
And what is it? What is the title?
The title is very apt to our discussion. It's called Surviving U.S. Healthcare.
Ooh.
Very important title.
Oh, yeah, that's potent. So you're going to tell us a little bit about how to protect and save our lives by becoming educated, empowered, and a leader of our personal healthcare team, and why we should only choose A-team physicians, how to do that, and how to support excellence in patient care. So I think I'm going to just let you take it away and tell us, and then also, of course, you're going to talk about optimal health that is accessible and affordable and accountable for all Americans. And I want to throw in one sidebar before I let you get started here. And that is that one of the things that I learned when I was in Britain is that I think it was in the late 30s, maybe early 40s, that most of the civilized world decided that healthcare should be a human right. And Roosevelt wanted us to go that route, to determine that healthcare should be a human right. We didn't do that. And I think we're one of the very few civilized nations now that doesn't hold that point of view. So with that entry, I'd love to hear you tell us just a little bit more about what your concerns are about the U.S. health system.
Well, and as we get started, Gallup recently determined that access to health care and affording health care is the greatest worry of Americans right now. So as we start this discussion, I think it's very poignant to realize you and I are discussing probably the hottest topic in the minds of most Americans. What I'd like to start off with is this whole idea of health. If we think about the term health itself, health is the greatest blessing that we have as individuals. Our health determines everything we can experience in life, everything we can do. We
Yeah.
live in a wonderful free country, which grants us rights to do anything we would choose to do. The limitation, however, is our health. And it's interesting because you don't see a lot of interest nationally in our healthcare system. And I think it's because what I found as a doctor is wonderful people, busy people, people who accomplish so many things, don't even think about this health. We take health for granted until we become very sick.
Yeah.
And as a doctor that took care of some of the sickest people in the world and saw some of the most productive, successful people suddenly become sick, suddenly become unhealthy in a situation where even the greatest doctors and minds of the world could not bring them back to life. And only then did they realize and say, I wish I had a thought about my health earlier. I
Wow.
wish I had done that. And what I want to do, what my book is here for, I don't want anybody in America or anywhere in the world to come to that realization at that point. I want us to think about our health proactively, because if we have our health, we have everything. People have said health is really wealth, and that's true.
Oh, yeah.
What I want to do is, having learned and studied and spent a lifetime in healthcare, realizing that what we once had in the United States in the 50s and 70s was the greatest healthcare system in the world had ever seen. Doctors were coming from all over the world to study with American physicians. And back in the 50s and 70s, the developments we were making with cardiac surgery, transplant surgery, and cancer treatment were phenomenal. And the key is the medical community was concerned, number one, with the status of excellent, superiorly competent healthcare given in a caring way. They were concerned with that. And the patients were coming in because they needed service. Now, what happened at that time is that politicians and business professionals saw what was going on. And also at the same time, our technology was generating an income potential that was phenomenal.
Mm.
And what happened to our country really almost overnight in the latter 20th and the 21st century is that healthcare was taken over by business professionals and politicians. It was taken away from doctors who have not demonstrated a great deal of leadership in political matters. And here's how they did it. The key relationship in healthcare for centuries has been the healer patient relation. We call it the physician patient relation. Think about this. The business professionals decided to change that, and they called it a provider client
Yes,
relationship.
that's right.
Now, I want you to think that you think of what's in a name. Well, think about it. Is somebody going to be more influential if they're a CEO of an insurance company or a pharmacology company, or are they going to be more influential if they're just a generic provider? Even the insurance companies still call the doctors they hire to deny care, they call those physicians.
Yes.
But they call the highest trained physicians and surgeons in America the provider. Now, they call the patient the client. And what they did, Deb, is set up this whole change by changing that relation, because there was a physician-patient relationship and there was nobody in between. But think about it now, between the provider and client, there are the insurance companies, the pharma companies, the government. There are so many people in that relationship besides the doctor and the patient that there is no way that can be a healing relationship. And in my book, I describe it as a deadly relationship. Think about this. Insurance companies have told patients what doctors they can see or that they can't see doctors. They
Well,
have
Medicare
hired
does that.
physicians.
I'm experiencing that with Medicare.
All right.
They
And
tell
think
me who I
about,
can see. I've got some great A-list doctors. Medicare won't cover them.
well, see, and as I'm saying in my book, unless you see the 18 docs, you're in danger. Now, here's the interesting thing. Insurance companies pay millions and millions of dollars for doctor salaries to hire doctors who never see the patient, never examine them, and they determine the care that they're going to get.
Yeah.
That's called malpractice in any other situation. When a doctor gives a patient care without seeing them and without examining them, every medical school in the country, every doctor would call that malpractice. But you know what? We don't. So you could say that it was only the insurance companies and the politicians that allowed it. But guess what? No medical organization has stood against those doctors. And in my opinion, they should lose their board certification if they prescribe care for patients they've never seen and examined. But as we get into this, what happened is the politicians and business professionals made healthcare a business paradigm, calling the patient the client and the doctor a provider. And as they did this, they changed the goal of American healthcare to financial performance
Mm.
and profit, and they disguise it in a beautiful word called affordability.
Oh, yeah.
Now, the danger of that word is we all love it, but what it really meant is what the government and insurance companies felt they could afford to pay for the health care we got. While after the Affordable Care Act was passed, the government officials in Congress and their employees, they got gold tier health care. So what we have is a healthcare system where financial performance and profit is put above excellence in patient care and optimal health. And the purpose of my book, number one, recognizing that, is to get every American to realize that healthcare has now become the third leading killer of Americans after heart disease and
Wow.
cancer, the leading cause of bankruptcy. Over 250,000 Americans die needlessly each year because of medical mistakes and negligence. 40% of adults in America avoid seeing a doctor because they don't trust. So that's
Yeah.
the setup. So in a setup like that, my first goal in my book, and what I'm trying to do, is to reach every American with the idea that, number one, we have a very dangerous healthcare system. Number two, there is a thing you can do right now. Right now, there is something you can do to change your entire future. And the first thing is becoming the leader of your personal healthcare team. And to do that, you have to destroy the biggest myth that we have right now in healthcare, and that is most Americans believe that they can't judge their health because of the
Mm.
scientific nature and all the degrees and qualifications that healthcare professionals have. So Americans are afraid to judge their healthcare. Now, what I point out is we became the greatest constitutional republic in the world because Americans decided they were going to judge the way they lived their lives.
Free speech.
Free speech, free living. And
Mm-hmm.
see, this made us who we are. Every American will tell you if they go to a restaurant, if they get bad service or bad food, they're not coming back. If they take their car in, they're comfortable to say that if the brakes weren't fixed, that
Yeah.
was a bad car place. But let me tell you what I talked to a woman one time who was one of my patients, and she was telling me that her husband was getting knee surgery. And I said, well, gosh, I'm concerned. Do you have a good surgeon? She said, well, it's the same surgeon that did his other knee several months ago, and the other knee was healthy. He had operated on the wrong knee.
Oh, my goodness.
And I said, wait a minute, you're going to a new surgeon? She said, no, this doctor has the best reputation in the community, and we think he's a great doctor. Now, in my book, I point out that wrong site surgery is the number one absolute a guarantee of an incompetent surgeon. And in my opinion, any episode of incorrect site surgery, you should no longer be a surgeon. And I'm urging that we address that. But this lady had told me that her husband was going to have the surgery on the sick knee by the doctor who had accidentally operated on the wrong knee. And there's nothing right about that. And time after time, I've had patients tell me that they did not like their surgeon or their doctor and they got bad results, but they thought that they had a great reputation.
Oh, boy.
So the number one thing Americans have to realize is we need to use our same common sense.
Mm-hmm.
If you're getting bad results, you don't have an A-team doctor. If your doctor doesn't look you in the face and talk to you instead of sitting over here on a computer, you don't have an A-team doctor. If your doctor doesn't examine you thoroughly and take time with you, you don't have an A-team doctor. If your doctor doesn't notify you of results promptly and accurately, you don't have an A-team doctor. And in my book, I list the classes of doctors from A to F so that people can judge. Your doctors are like basically any other service you would get. Americans are good at assessing service. And the number one rule of an A-team doctor is they practice what I call the golden rule of medicine. They take care of patients the way they would care for anyone they love.
Mm-hmm.
Now, the other factor of an A-team doctor is they have excellent credentials in medical school, residency, and fellowship training, and they also are certified in the appropriate specialty. But think about it now. When you talk to people about seeing their doctor, so many of them never ask their doctor where they trained.
Yeah.
Do you recall asking your doctor if they're board certified?
No, I never ask. I see it on the wall usually.
That is good. I'm telling patients they should ask their doctors about their credentials and report it. And here's the interesting thing. Doctors in many specialties, in my specialty, we had to be recertified every year. So
Wow.
you could have a board certification on the wall that says, 2009, but you may not be certified now. Very important to ask.
Something else came to mind a few minutes ago when we started talking, but you said you want every American to know this. I really want to make the point to everyone who's watching this or listening to this podcast. If that matters to you, if you think it's important, share this. Put it on your Facebook feed, put it on your Nextdoor feed, put it on LinkedIn, send it to your friends, but make sure that you get it out there on social media and that you talk about it, because that's how we change it. That's how we fix it. So I just wanted to put in an ad for you there. I think that that's critical. We need to help you help us and
Well,
help the country.
and Debbie, it's so amazing. Here's one of the things that just blew me away when I became a doctor and started doing public education. I would go out and give a talk to the public and mention something. And I would get a call back from a patient who had that problem. We'd bring them in and their life would be saved
Oh,
just from what they heard in a talk.
yeah.
To me,
Yeah. So
health
this is serious
education,
stuff. This is
well,
life
health
saving.
education to me is the most exciting education because I've seen it save lives on a day-to-day basis. It
Wow.
was one of the most exciting things that I've ever been experienced with, to be able to give a talk or even have some article of mine in a woman's magazine where they
Mhm.
read it and immediately found a problem, came in, and we got them cured of
Wow.
cancer very often.
Wow. That's
And see, it
incredible.
taught me to have this statement. I think all Americans should believe this. Only an educated patient is an empowered patient, but an educated patient is truly empowered. And of course, we live in a world that's consumed with education, but because there's so much out there, we have to take it upon ourselves to make sure that we're getting the truth and not all of the fantasies that are all there out there with it. And I encourage patients and all Americans to start becoming educated, empowered leaders of their healthcare team. And what that means is, for your personal healthcare, the patient, the adult patient, should be the one who makes the final decision. They should be an educated, informed, and I'm suggesting that they pick a primary A team doctor, the primary doctor being the main doctor that takes care of you, as their co-leader. But ultimately, they need to be the supreme leader. And think about it this way, because if there is a problem, the patient in this healthcare team relationship is the one that has the most to gain or the most to lose.
One of the things that I observed when my mother had leukemia was that when you're really ill, you don't always have what it takes to advocate for yourself. Many, many times you have people who are really too ill to look out for themselves. Is that why you're suggesting that we do it up front in advance?
Yes. And here's the other thing, too, because it is so important to begin this discussion about health education. If you do this up front, before you get a serious illness, you're also teaching others around you. Like you mentioned this earlier. I would urge Americans to talk to their neighbors and say, every one of us needs to be a healthcare leader. This allows you, it empowers you to become the leader of your minor adults and dependent adults. But
Right.
also, you get a healthcare, you form your healthcare team by picking a team healthcare professional, but also the appropriate relative. And in the
Yeah.
healthcare team, I suggest that we all designate one to be the one that takes over when we get in the situation you just described, because it's very possible to become so sick that you need help in
Mm-hmm.
doing that. But if it's interesting, and so many times the term leadership, there's never been more book, more seminar, more degrees, more title in the world about leadership. And in my opinion, there have never been fewer examples of truly excellent national, international,
Yeah.
political, medical, you name it, leadership.
Yeah.
So what I'm doing in my book is also challenging patients to study about leadership, to learn some of the major things about character, about courage, about communication, things that really help them.
Mm-hmm.
Because as they become students of leadership, they realize that the person who is in leadership needs to be decisive. They don't need to be hesitant. They don't need to be shy, but they also need to be prepared and educated. It's exciting because what I find is in patients that take leadership, I've always seen them do better and their families do better.
Of course.
And leadership can be evangelical. In other words, when people see leaders, and leaders tend to make leaders.
It's contagious.
It really is. So I think this is so important, because what we're trying to do here immediately is, if a person becomes the leader of their healthcare team, and there are those that still doubt it, and to those I would say this: what do you call the person who has the power to hire and fire? The boss, right?
Yeah.
So, in other words, one of the key things about being a healthcare leader is knowing when to hire or fire different doctors or healthcare professionals or institutions. And you have that power as the leader.
And even as a client, you have that power.
Right.
Even if you're sidelined as a client rather than a patient, you don't have that same
Right.
relationship. One of the things that you mentioned too is it should be accessible, affordable, and accountable. How do you ever make it any of those things?
You have said a beautiful thing, because those are the things that scare Americans the most. Accessibility. Now, here's something that is amazing. But during this takeover of healthcare by the people that wanted it to be a business paradigm instead of a service paradigm, during that business takeover, it compromised the excellence in patient care so much that it scared people to death. And now they're just worried about, can I even get it, afford it?
Yeah.
And so the debate's been about that. And you notice for the last, even since before the Affordable Care Act, but certainly after, all the debate is about affording it. But think about what's scary. What about being killed? What about being one of the 250,000 people killed? See, what happened is these finance business people and politicians have even taken the debate about competence. In my book, I say competency, extreme competency, is what a surgeon needs and a physician. That's the thing I tell people to look for. Now, you want them to be compassionate, but you can't do anything without extreme competency. And in this debate where that's been put out, nobody ever talks about that. That's been the most frightening thing of our healthcare situation, is that the concept of competency has been left out. Now, why it was done is because the politicians in business in the original meetings said we can assume competency. And what our statistics tell us now is that when you make finance the most important thing, you cannot assume. You cannot. Because wrong site surgery right now is one of the worst problems in American medicine. It's increasing. Some people have said it occurs as many as 40 times a week. So when you make it about the business, you eliminate competency. Now, the first move to make that happen, I don't know if you knew about this, is the powers that be started saying that physicians could only spend a limited time with patients.
Yeah, 5 minutes or something, in and out. Yeah.
And in fact, many medical schools fell right in line with it. They said you can only spend 15 minutes with a former patient and 30 minutes with a new one. And I can tell you, if you have a complex cancer patient and you spend only 30 minutes with them, you are not an A-team doctor. But this happened, and even medical schools put light and other clinic in over the room, so that if it was over 15 minutes, some administrator would go in there and say, you got to get moving.
Oh, dear.
See, this was going on. I don't know that Americans knew this was happening. Now, all Americans now will say, my doctor doesn't spend enough time with me. But think about this, and I want people to know this. Affordable, business-centered healthcare is minimal physician access healthcare. So, in other words, if we're going to make it all about the money, you're not going to see your doctor. And so we have to go back. And this, I know a lot of people think I'm crazy talking about quality, but as a cancer surgeon, I can tell you that quality and competence is all the difference.
Well, you're the qualified one to talk. I mean, if anyone can talk, you can.
Well, see, and what I want us to do, and in my book, I'm proposing a new bill. It's called the U.S. Excellence in Patient Care Act.
Yeah.
And this is what it does. It changes the entire topography. No longer will the primary goal of U.S. or the primary purpose of U.S. healthcare be profit, affordability, and financial performance. It will be excellence in patient care and optimal health that is, number one, accessible, number two, affordable, number three, accountable to every American, to all Americans. We can do it. We have the finances in the country to do it.
Where do we
have
find
to focus
this bill?
on the health.
And where do we find it? Is there somewhere we can go take a look at it, or vote in favor of it, or tell our congressman, yes, we want this?
Yeah, well, see, here's the beautiful thing, and you alluded to this earlier, Debbie. There's an old statement. People attribute it to Gandhi, and some people attribute it to Eisenhower, but it's like, when the leaders fail, the people will lead. It used to be a bumper sticker, remember?
I love it. That's a good one.
And so this has been true in America. You know, in our greatest times as Americans have exercised that personal leadership. Sometimes when our country's been down and out, we've acted like victims. But when Americans are at their best, they're exercising that leadership. So my proposal is this: if you notice, as bad as this healthcare system is now, you've not heard anybody in the national media say we're at a dire emergency. You've not heard anybody in Congress. You've heard nobody in any form of government, state or national, act like there's this big a deal. And I'm saying that it is.
It is.
And so I'm saying when the people lead, the leaders will follow. So the purpose of my book is to sound the alarm and to get Americans to be the leaders of their healthcare, to evangelize the importance of health and healthcare leadership, and then to help me get this bill passed. In my book, I've got a letter that they can copy on my website to every congressman and to the president and to all the officials they want to begin to call attention. The first thing we got to do is call attention and have a groundswell effort. And then the next thing we've got to realize is think about, if we agree that health is our most precious resource as a person, think about what's the most precious resource of the United States: the health of its people.
Absolutely.
It's the most productive. In my opinion, the U.S. government should do that first.
Mm-hmm.
I think any one of us realizes the first thing that needs to be defended is the health of the most resource.
Well, the government's responsible for our safety.
Right.
And for our well-being. It's right there in the Constitution. It's right up there in the Declaration of Independence, and we can follow that lead or press that lead. I know different states have different systems. Is there anybody you think's doing it well or doing it right? Or at least
nobody in this
part of it
country,
right?
I think, is doing it anywhere near right. And it's because every state and every person in this nation is looking at healthcare for profit, financial performance, affordability, and healthcare is way too complex. Saving a patient's life, you can't put money in front of that. What I point out is, Sue, we've got the best business people in the world in the United States. And there are many business professionals that realize that you can design an affordable healthcare system that has excellence,
mm-hmm.
But business has to be the second. Finance has to be number two. And this has been the biggest nightmare in the United States healthcare. You see, when the business people started bringing this in, they were encouraging physicians. I don't know if you knew this, to get MBA.
Oh,
so
dear.
when they started the business paradigm, and you know how doctors love to study, many of them went out and did it. They sort of created the new generation of physician leaders as MBA physicians. Nothing wrong with it, but they really wanted to take that emphasis off patient care, and it cannot be. So what I am suggesting is that we take, and one of my chapters actually is, let me ask you this. Do you think there's anybody in this country that would admit to being responsible for this healthcare system?
No, and that's why no one fixes it. Because it's too complicated, it's too complex, and because there are too many lobbyists, the insurance companies have too much money. Oh my gosh, we'll lose all these jobs, and and same with big. Oh, we won't be inventing anything if you don't give us enough money. But you know what? It happens in other countries. There are other ways to find that money and find those jobs.
And I love what you said, because see, I believe every American would say just what you did. Nobody accepts leadership responsibility. And think about it. One of my chapters is called Healthcare Leadership: From Oxymoron to Empowerment. And I would say the term healthcare leadership is the biggest oxymoron in the world right now when it refers to U.S. healthcare.
Yeah.
Because that was the first thing. Think about the Affordable Care Act that was passed, had nothing in it to make the healthcare system accountable. There's nothing in it. In fact, the people in Congress aren't even checking. The executive, the legislative, the judicial branches, nobody's paying. So to tell you a little about my bill, I am suggesting that we look at healthcare. Nobody even studied healthcare before that act was passed. I'm suggesting that we form a presidential healthcare executive leadership team. Excellent. And state healthcare executive leadership teams in each state. And the presidential healthcare executive team would be composed of 6 citizens, 6 physicians, 2 senators, 2 congressional representatives, the Secretary of Health and Education, and the vice president, and have a leader. And the president would be an unofficial member. He would not be a voting member, ex officio. And
Mm-hmm.
with the same with the states, but it would be the governor that would be the ex officio. But there would be citizens, because here's the other thing. Anytime the government controls healthcare without accountability, your healthcare is in danger. So I want citizens. I want a good number of citizens on these commissions. The presidential executive healthcare leadership team and the governor state healthcare executive leadership teams will do a 1-year study of U.S. healthcare. And then they will write up the new healthcare bill based on that with the following things. Number one, never in the world has it been said, but it will be said in this bill, that the number one resource of the United States is the health of the citizens, and it will be the number one duty of the government.
Yes.
And to be accountable. Now, that presidential healthcare team will report every year to the people of the United States, to the president, and to the Congress. The governor's healthcare team will report every year to the people of the state, to the governor, and to the local legislature. But you see, you've got to have annual reporting and accountability, or you've got nothing. Right now, for years and years, nobody has looked or even tried to see. I believe that this type of legislation will work, and it will allow for insurance companies. It will allow for Medicare, Medicaid. It will allow for other type of private initiatives, but there will be no things like the government or insurance companies telling you what care you can get or how you will be cared for. In other words, their job will be the real provider. They're the providers, not the doctors, the providers of money. Right now, the insurance companies are denying so much health care, and it's a big business. I call it in my book, trading lives for dollar.
Yeah.
They're hiring doctors at salaries that would be more than that doctor would make in practice.
Wow.
And that doctor is denying care for people that they're not even qualified to see, much less the fact that they don't see them and they don't talk to them. The other thing is, it's very interesting how the legal profession has not made any big deal about suing these doctors. Very interesting. These doctors are not getting sued for practicing malpractice daily by denying care for patients.
Yeah.
And that's one of the biggest errors in our whole system, is these doctors are doing this and denying every characteristic of being a true doctor by making decisions about patients they never see or never examine. So I would also in my bill put a limit on expenses that can happen to a single family. And you see, that has to happen because we don't want a healthcare system that kills Americans and bankrupts. We want one that makes people well, that gives them every opportunity to pursue all the advantages of a free country. And what I'm calling this is the second American Revolution. Think about it. The first American Revolution gave us the greatest constitutional republic the world's ever seen and gave the potential for you to do more with your life than any other person. Yet, the only thing that limits that is health. If our second American Revolution gives us the best healthcare system the world has ever seen, then we have truly come full circle and become the people that I think our forefathers, our God,
we want it back. Yeah.
To me, see, this is the ultimate. It's the ultimate battle. Now, I know our country's so divided, and you know that our country is so divided, and that's upsetting a lot of people. And I think we should approach this one great revolution, this one great feat for Americans that we could do in the next 5 years. I think we should approach this in unity. We should let this unify us. Of all the things that we're upset about, if we had an excellent healthcare system, I think we are prepared for the future.
Are there countries that can act as role models for us? Have you seen systems that really work well?
I have not. Healthcare in the United States, we have this free country, this wealthy country that has traditionally allowed people to abuse themselves to the max. And in my book, I talk about there's a difference between healthcare types. There's preventive care, and then there's interventional healthcare. Here's a big prelude to that discussion because, see, think about it. Preventional healthcare is telling you how to stay well.
Yeah.
Interventional healthcare is getting you well after you got sick. In early mankind, preventive healthcare started being the only healthcare. But then there were people trying to help people who were harmed in combat, in trauma. They were trying to help people who got sick because they realized prevention didn't work all the time. And after a while, in most civilized countries, interventional healthcare took over. Think about it. I mean, the
Yeah, that's
United
right.
States,
Hmm.
we're the greatest model of interventional healthcare that the world has ever seen. And as I said, in the 70s and 50s and 70s, we were the top. But that system is based on somebody getting sick and us intervening. America began to expect miracles. Think about it. They began to say, all right, I'm going to abuse myself with cigarettes, drugs, abnormal, terrible behaviors. I mean, we're one of the only countries where obesity is a symptom of poverty. I mean,
Yes,
we have abused ourselves, and it was not popular in the 50s and 70s to talk about behavior modification. I think we're starting to see that it is now. But what I'm saying is, in our country, we expect a healthcare system that no matter what we've done to ourselves will make us better. And the preventive healthcare was more of an Eastern philosophy that prevailed in Eastern countries. And as a young medical student, I wanted to be the doctor that could take care of you no matter what. I wanted to be the one that when you were denied surgery or somebody opened you up and closed you and said you couldn't be cured, you came to me and I cured you. That's what I spent my life doing. But I thought, oh, this is the great, but it took me quite a few years to realize, isn't it a miracle if I can cure you with a 6-hour cancer operation? That's a miracle.
it is.
All right. But what about this? What if I could teach you how to prevent cancer and never have that operation? Which one would you rather have?
Yeah. Yeah, that's a
You see?
no-brainer.
But
Yeah.
now think about it. In America, we have popularized interventional healthcare, and that's where all the board certifications are. That's where all the medical schools are. That's where the lawyers sue. That's where everything's going. But now, what about preventive healthcare? That's become a consumer industry in the United States. So if you go on the internet, you'll find that you can take this leaf and it'll cure everything. Even though all these things have different causes,
And
it'll
one
cure
size
everything.
fits all, too.
You see, so what I'm saying is we've let preventive care, which I think is key to excellent healthcare, we've just let it be a consumer industry, and there's not enough control over it. On the
Hmm.
other hand, we've got too much control over interventional care. And I will tell you that I first thing we've got to do is get preventive care and interventional care together. And we've got to put extreme competence. We've got to establish extreme competence and excellent results in both of those things. Now, after that, we work on the financing. We can finance this because we know that America right now spends about $14,000 a head on everybody. That's if you look at our healthcare expenses, we're already doing that. And a lot of people will tell you, well, they didn't spend 14,000 on me last year. What I'm saying is we're spending the money, but we're
Hmm.
getting a bad result. So what I want to do is start from the beginning and say, let's have excellence in preventive healthcare and excellence in interventional. Now, the reason the other countries I don't think are as good, and I've worked with, there's great doctors across the world, great.
Hmm.
But what I have noticed, in my opinion, and of course I'm biased, but there is no country has the talent that we have, and there's no country that has as a doctor, I was always being consulted from other countries and had patients coming from other
Hmm.
countries. And places like Sloan Kettering Cancer Center or MD Anderson Cancer Center are some of our greatest heart institutions. We have the best. But what we have done is messed up. We've sacrificed quality for the financial profit,
Hmm.
executive compensation. The idea of socialized medicine, which England had, and I have many friends in England, and they all told me that they had their own private health care too, because the
Yeah.
wait was too long.
Hmm.
But it's a good system. I will say to you, and I would agree with people, if you can get health care and you're not denied that, there are people being denied health care, and that should never happen. What I
Right.
say in my bill, the U.S. Excellence in Healthcare Act, is health care is a privilege that is afforded to every citizen in this country.
Should
Now,
be. Yeah.
because people talk about right or this, it's hard to make the case for a right, but it's a privilege, and every person in a successful free country should have it. And so in my bill, that's in there. In other words, every United States citizen has health care.
The critical thing that all of us could do right now is go to Amazon and get your book. It's going to be a guide to how to do all of this.
Well, see, that's what I would like, because what I'm trying to do is teach leadership in healthcare personally, and then to your friends, your relatives, and let's get this going. I've got a
Let's take
letter in
care of
there
it.
that people
Yeah.
can write to every representative if they copy it on my website. because let's get the debate going.
Yeah. So tell us how we reach you. You've got a website,
And that's called survivingushealthcare.com.
and that's the name of your book as well, Surviving U.S.
Yeah,
Healthcare.
I'm trying,
Okay.
yeah, trying to make it easy.
SurvivingUSHealthcare.com.
I think that's the first thing is getting everyone together in this country,
Mm-hmm.
getting the debate.
Mm-hmm.
Gosh, think of the things that are on the national perspective right now besides healthcare.
Right.
None of them are as important as the health of our citizens. And what I'm saying is, I know that we can achieve the greatest healthcare system in the world. We have the
Oh, yeah.
greatest talent. We have the greatest finances. We've got, and our business experts, they're great. We just need to get them to understand that health is more important than money.
Right.
And
Right.
yes, you can have executive compensation, but it cannot be obscene. And insurance company compensation for executives has been obscene.
Not at the
And
expense
pharmacology.
of
Yeah.
not at the expense of the people.
Right.
And yeah.
And you see, interestingly enough, as a doctor taking care of sick patients, my fees were set by the insurance company. Think
Yeah.
about it. If I'd wanted to be rich, I would not have gone into that profession. I was happy because I understand that. In other words, I expect some kind of fair compensation, and I did get compensated reasonably, but I didn't demand. For instance, what would you say a human life is worth? I had a lawyer one time ask me that. What is this baby's life worth? And I told the lawyer, I said, you have no business even in this courtroom if you're going to try to put human life in terms of capital, because it's not. And see, my point is, doctors have understood we don't expect to be compensated for the real worth of a life. But see, the pharmacology people need to understand they shouldn't be compensated unreasonably, nor should the businessmen in large hospital corporations.
Yeah. Yeah.
And insurance companies. And see, the big four, what politicians, they're powerful. The insurance companies, the pharmacology, and the national hospital system. Every time we have a discussion about healthcare that I've ever had, whether it's a sports professional or a citizen or a business person, a plumber, a carpenter, everybody, or a physician, they always end up saying, well, nothing's going to be done about this because of the big four powerful people that are entities that are benefiting. But see, I think that's not right. I think we're fooling ourselves. We got to begin to speak up.
Yeah, things can be changed. It's not easy. It takes time and it takes an awful lot of work, but it can be done. I've seen it done many times. And that's why I do this podcast, because I have stories of people who found corruption and how they found it, why they found it, but then how they fixed it, because you can fix it, but you have to believe you can fix it. If you believe you
You
can
hit
fix
it.
it, you're going to be right.
You have to. And one of the things I say in my book, every United States has faced a crisis. It has always overcome it. One of the reasons is because of the leadership of the individual United States citizens, also a belief. And you hit it, Debbie, you hit it. A firm belief in the righteousness of the cause for the people of the country.
And you're right. We can all get behind this. This is not, this isn't about political parties. It's just about the health of a nation, the health of our health system.
To have fun doing this. I want us to have some fun trying to make things better.
That
and
committee
talking to
sounds
people.
wonderful. Those committees, I can just imagine how exciting it could be to try to find solutions, because they are out there. Of course, they're out there.
We just need to encourage one another that it's not too big. People say it's too big. Just one quick thing. I helped my local community in Lake Hartwell stop chemical companies and quarries that were trying to pollute the lake. And when I started helping them as an expert witness, they all said, oh, it's done deal. Politically, there's nothing can be done. And
That's people's favorite line. It's a done deal.
Yes.
Yeah.
And do you know that they stopped them?
Mm-hmm.
They stopped some of the most powerful, wealthy corporations in the world from polluting the environment. And of course, that's one of the parts of healthcare.
Yeah, absolutely.
Prevention, we've got to watch what we take in and watch where we're surrounded. And then we have to be responsible about how we access it. But to finish on that last thing, many countries have formed socialized healthcare. And at least they've gotten to where all of their people can get healthcare. But the problem is, my experience is, the care they're getting is, number one, way too late for America. Number two, it's not as good. And the last thing I'll say is, whenever somebody does anything other than extreme competence in patient care, people die.
Of course.
And you see, when you put finance to limit it, finance has got to be secondary. That's the main point I'm trying to make. And even a lot of doctors don't agree with me on that, but I'm sorry.
That's because they drank the Kool-Aid.
There has been a lot of Kool-Aid. But I do think doctors and patients overall are a natural union. Patients leading because I think most doctors are so concerned about their patients. They love them and they're disempowered too.
The whole time you've been talking, I keep thinking this has got to be so incredibly frustrating for doctors who all they really want to do is help people and make people get better. Now, maybe some of them maybe do want to get rich or maybe get rich as well. But at the end of the day, it's got to be so frustrating to have 5 minutes with a patient and then be expected to heal them.
It really is. See, I think that's one of the problems is I think the American public has become disillusioned, but the
Yes.
physicians themselves who
Mm-hmm.
have had more training and certification and over supervision than any profession I've ever known. In other words, even their own, for instance, give you an example. Some specialties decided that they wanted to certify their people every year. Board certifying you every year is not necessary, has never been shown to help in any way, but they've just been putting that oppression onto the local doc. I think right now in our country, some of the most oppressed people are the clinical physicians taking care of patients because they've been overregulated and underappreciated. And
Undervalued.
absolutely.
Yeah. And that keeps coming back to me too. Who should be determining the care? It's the doctors, not insurance companies or pharmaceutical companies. It's doctors, it's physicians who should be determining what care we should get. They're the experts.
And see, that's one of the things an A team doctor, and they're only about probably 15 to 10% of the doctors in the country I would call A team if you look at my criteria. But the key to those is excellent training. They care, they communicate honestly, and they perform with extreme competence. So not only do you, when you're looking for one, you can ask professionals, you can ask healthcare professionals, friends, go online, look for the 5 stars, look for the ratings from some of these physician rating companies, Best Doctors, Castle Connolly, Super Doctors. Also, what I teach the patient is you have to keep watching them because it's actually the results you get really determine that. And they also have the best possible staffs and they uniformly work at great facilities. A team doctors are so visible that when you've been with one, you're really shocked when you have to see a B, even a B or a C or a D. The key here is for the individual to be educated about health, then educated about their physicians, understanding the problems in our healthcare situation, be a leader, and pick the best physician team. But also support physicians, support us all in this healthcare, because only when Americans determine that their healthcare is going to be excellent, number one, are we going to have that. And I would argue if Americans wanted to be number one in anything, I would rather it be healthcare. And, I'm hoping that Americans will, as we go to unite for this effort and other things to make our country its best, that we will take it easy on each other and
Yeah.
and and
Yeah.
enjoy music, enjoy the arts and entertainment, because I think we've been too uptight for a long time.
Yeah. Let's find what we can agree on and enjoy together. Yeah.
And have some fun. These discussions, just like talking to you, has been fun. We can have these discussions. We can do these things, but have fun doing them.
Mm-hmm. Mm-hmm.
I
Yeah.
think the country right now is pretty uptight, and we have an excellent chance to make the greatest healthcare system in the world if we just unite on that.
Well, thank you. I really appreciate your time and feel very honored to have you as a guest. And let's see what we can do to move this forward. Thank you.
Well, thank you so much, Deb. This has been fun.
Yeah, it has. Really delighted to meet you and thank you for
Thank
coming
you
in.
so much. Look forward to
Okay.
seeing you in the future.
Good night.
Night.